Okay.
Tyrone, thank you for that introduction. My name's Mark Holmes.
And my name is Mark Gorman.
When we were first looking for a skin technology machine for our clinics, we decided to draw up the list of the things we wanted and the things we didn't. Mark, do you want to kick off with the things that we're actually interested in having?
Yeah, so I think whenever you're looking at a new treatment, you want to look at the first principles of why it works, know its downfalls, the realistic side effects and downtime that you're going to have with it, but also, know what you're aiming for, what your target is, what your aesthetic target is. So one of the things for me is that, given that I've had fairly long training in aesthetic surgery, where you're looking at your ability to change eyelids through operative blepharoplasty or skin through facelifts, you want something that's going to, that actually, if you're going to choose an alternative, it's really going to have a bang for its buck. And the things that you're generally going for when you're regenerating skin are texture, tone, that you can treat pigment, that you can treat active and fine lines. The ability long term that people are starting to look into in preventing actinic damage, non-melanoma skin cancer, and more recently, the buzzword really has been neocollagenesis. And you see it increasingly in magazines. People are starting to become more aware of this. Ultimately, it's safe. On the flip side, you want to avoid long morbidity and downtimes, and they're associated with its next big rivals, which we'll come to, which really is CO2 laser. That's been the gold standard for a long time for this sort of thing.
And certainly with me primarily involved in aesthetics, downtime is a huge thing. People come to me because they want instant results. They want results which they can actually see a difference, but they don't want any downtime at all. And, if possible, they want very little pain and very little complications. And that's why I think we put in the mark there about, certainly when I've done medium to deep peels, there is always that worry, even with feathering, that you are going to get some demarcation lines.
I think that's true. And I think the thing that people don't really realize in the public is that if you're going to get a proper result from a laser, you're talking about two things: pain that's not that you're not going to tolerate without maybe having a general anesthetic, and B, a downtime that's probably going to extend to about 3 months.
Yeah, well, I work in a hospital, so I do have access to anaesthetists, but for the majority of aestheticians who are in a clinic on the high street, they just don't have that sort of facility. So when we decided to boil that down, we came up with a list and sort of, thought about what we really wanted. And the big problem we found was that a lot of the machines we looked at either didn't work at all, or certainly the improvement, we might have detected a small improvement, but the patient couldn't see it themselves.
No. And so when you're saying that other machines weren't efficacious or didn't work, and what were the other things that you sort of toyed around with or considered?
Well, I certainly looked at RF and things like that,
yeah.
And I was looking at the before and after pictures and struggling to convince myself which was which. If I can't see the difference, the patient is never going to see the difference. And when you were moving up to machines which were more high powered, the problem was that there was too many potential serious complications. Obviously not with every patient, but the potential was there, and that frightened off a lot of the type of patients who come to see me. Yeah. Not to mention those type of machines which you could get results, not only expensive to buy, but to set up a laser room, for instance,
yep.
and to train the staff and keep them up to date. So when we boiled it down to the criteria we really wanted, what drew us to the NeoGen Evo platform was the fact that it was safe with minimal complications, which we could easily manage ourselves. It was effective, and there was actually clinical improvements in skin tone, texture and laxity, which not only that we could see, but the patients, and just as importantly, their friends and family could see as well. And also from a business point of view, that it was profitable with high margins over multiple treatment modalities.
Okay, so this is just a disclaimer slide, same as you have in anything. So me and Dr. Holmes, Mark, we're both called Mark, slightly confusing for you all. So we've got a disclaimer. You have bought one of these Evo machines, that this webinar has not been paid for. We've done it very much because, having liked the machine and feeling slightly evangelic about it, we want to share our positive experiences. We're, as it says, now both on the advisory board, and moving forward, both of us are going to add to the sort of research Oh, sorry, I didn't realise I was in shot there. Hello. We're looking at adding to, there's areas with the plasma machine of research that haven't been properly covered. We'll discuss those later on, and so both of us are currently undertaking that.
Let's move on. Okay, so tell us a little bit about plasma then, Mark. What is it?
So this is kind of our Star Trek slide. So plasma, as listed there, is called the fourth state of matter. Now, in the simplest form, you'll see lots of terms that are bandied about. Here you have UHF energy. The way in which plasma is created within the EVO machine, much like elsewhere, is that the nitrogen is ionized, which is that it has the electron stripped. That happens through radio frequency energy. So the UHF just refers to ultra high frequency. That's simply the speed at which the radio frequency pulse deionizes the nitrogen. The reason that nitrogen is used is that as it does this, it remains stable. The plasma is then emitted from, and you'll see a video in a minute, from the NeoGen head, and this at that point really is just conducting heat, and it just does it in a reliable, predictable way. There's some bits there about not chromophore dependent. That's about lasers. We'll come back to that. And so the bottom line is that plasma is stable. It emits a predictable thermal conductive injury over both a predictable width and a predictable depth, which can be changed dependent on the energy setting that you choose. So should we move forward just to show what this is?
I just would like to make one point. I particularly like the NeoGen machine as well, because it was using the nitrogen, and it's the only machine that does, because there are some other plasma machines around, but they use oxygen. And the problems I was finding with those is there is the fact that you can get some charring of the skin. So yeah. I think that was a really nice sort of idea of them to use that technology.
Well, just pausing there. So what would be the problem with, just to explain that, what would be the problem with that?
Well, just the charring is unsightly, you know, and it's obvious that you've had a procedure.
Well, what I meant was, so in other machines, so something to share with people is that one of the big problems with lasers, CO2 lasers especially, is that the charring is caused by oxidative carbonization, and that's a posh way of saying that, because with plasma it gets rid of the oxygen that's around the skin. And by doing that, it doesn't cause charring. Very simple problem with charring is it can cause scarring, and that's one of the worst things that can happen with laser, which doesn't happen with plasma.
Yeah. Do you want to talk about this slide for us?
Sure. So here we have the handpiece. Now we are going to see a video because conceptually it's a bit difficult to understand this until you see that. However, this is showing that, as I said earlier, you get the handpiece. It's on the left-hand side. Out of that comes the plasma pulse. This plasma pulse you can see in 3 gradations there, from the lowest joule, which is 1 up to the highest 4, and you can do in between. Most people tend to choose a lower one of around 1 to 1.5 or a higher one of around 3.5 to between 3 and 3.5. The area that you can see, the top of it represents the epidermis. Below that you've got the dermis. And when you're on the lower settings, the conductive heat, in a lot of the papers that you read, they talk about a zone of ZTD, a zone of thermal damage, or a ZTM, a zone of thermal modification. So that refers, so the zone of modification refers to the deepest area that the heat conducts down to, which is the papillary dermis, i.e. the more superficial part of the dermis. And that happens when you're on a higher setting, and it goes to a predictable depth, around 5 millimeters altogether, much lesser for the actual papillary dermis. That's going from the epidermis all the way down. When you're on the lower settings, it does about half of that, and the important things are twofold. The depth to which you go is the degree of collagenesis that you get. It relates to the downtime, and with peels, that's unpredictable. With laser, there's differences which we've already talked about and touched upon slightly with charring. Mainly, though, that it doesn't leave the epidermis intact, and we'll come back to that in further slides. Okay. So this slide is just showing the range. So again, PSR 1, 2, and 3. That's analogous to the lower or higher energy settings of the joules. So PSR 1 would be, and that's referring to the old machines. This is the precursor machine to the EVO. So that'd be a 1 joule setting. PSR 3 would be a 3 joule setting. And this graph just pictorially shows that with higher energy settings, you get a greater improvement in all the things we've talked about: texture, tone, pigment, RHYTID correction. Full CO2, which is say CO2 laser, is right up at the higher end, but it's also at the higher end of downtime. A 3 joule energy setting is fairly close in terms of its improvements to a full CO2 treatment, yet the downtime is about half. Similarly, peels, which have the same, it could be argued, depending on which papers you read, more pain than the plasma treatment, have neither the improvement yet confer a greater downtime. And so this graph's just trying to show that you get both the improvement, lower downtime, and we'll come to other things about pain and toleration later on. And
I like the fact that the NeoGen Evo is easy to use. Yes, of course, the more you use it, the more slick and the better results you get. But I find that sort of particularly with medium to deep peels, a lot of it actually depends on the skill of the person doing it.
Yeah, completely.
You know, there are some people who get incredible results with very little complications, but there are other people who get lots and lots of complications because it's a steep learning curve.
Yeah.
Okay.
So this is just pictorially to see, because a lot of time we talk about complications, but people don't really know what you're talking about. If you've not done enough cases, you certainly won't. So with the laser and the skin peels, here you can see on the top you've got hypopigmentation. On the top left, on the top right, you've got hyperpigmentation, and then below that you've got demarcation lines that are almost pathognomic of skin peels, strong ones such as the Abaji Blue, strong TCA peels, or laser treatment. And there isn't much getting away from it. So one of the big advantages with the plasma machine is its ability to treat pigment. Now, if you've got, for example, pigment in just a cheek area, and you do it with a CO2 laser, you will get a demarcation line, you will get a degree of hypopigmentation around it, and therefore the temptation is to treat a whole face and to overtreat. With the plasma machine, you can just freestyle and treat the areas that you want.
I think that's an excellent point.
Yeah.
For instance, you know, if you're doing a 1 joule treatment for the whole face, you may have a patient who's got a sort of rather deep age spot in the middle of the cheek, and you just for that one little area, you can turn it up to 2.5 just to blast that one little spot, which I think is the beauty of it. And it recovers with an even tone rather than leaving them with a big demarcation mark in the middle of their cheek.
Well, in fact, you can just be a nuanced practitioner, can't you? If somebody's got, and we'll come to these but later, but if somebody's got one droopy eyelid, you can treat one rather than two. The other thing with this, and we'll come to the papers, is that the rates of hyperpigmentation, we'll repeat this because I think it's really important, with a plasma machine are, well, long term, it's been shown not to happen. In the short term, it's about 4% in cases. I don't know if you can remember what they are with the CO2 lasers.
I can't remember.
Certainly
above 10, isn't it?
It's massive, actually. It's
really?
Like 40%.
God, that shocks me. I didn't think it was that high.
Yeah. And that's at about the 3-month mark.
Wow. Of all the patients we've done on whether they've been on the 1 joule or even the 3 joules, we've had no long-term hypo or hyperpigmentation. I had one Spanish lady who was Fitzpatrick 3 who had a couple of hyperpigmentation marks below her right eye, but they were transitory and they've gone within a couple of weeks, which was a relief.
Okay, so the unique features of NeoGen plasma skin regeneration. So I'll read the point and I'll expand to explain what they mean. So here, as it states, it works at and below the surface of the skin. So by that, it's just talking about whether it's the epidermis, so, you know, from the Latin on dermis, to below that. And before I said that it works mainly in the papillary dermis, that's the superficial layer. And there are lots of important points with that. You know, we can go into the histology and explain that at day 10 with plasma machines, you get an intense fibroblast reaction, which is where you get the collagenesis from, and elastins. That's both a kind of tightening of the skin that you see, and up to a year and beyond, collagen improving. And there's something particular about the NeoGen machine with that, because they talk about the difference between planar, don't they, and vertical change of the collagen.
Yeah.
And below the papillary dermis, once you get into the deeper areas where you have hair follicles, and this is a problem with both peels, and so with peels, why is it that they can extend deeper? Because you've had quite a lot of experience with the blue peels, haven't you?
They can. I mean, I used the blue peels originally just because it's meant to penetrate slower, because particularly with sort of TCA peels, a lot of the problem they were having is they were going down too quickly, weren't they? Even in very skilled hands. So they used the blue dye to help slow them down. But it also depended on how much you were actually putting on your sponge and how many coatings you were doing. And that's why I feel particularly safe with this machine, that dependent on the skin type and the level of hydration and the JOULES setting you're on, you know exactly what depth you're going to.
And the key thing here is, and we've seen it, you've seen it with patients who've come from other people, is that left on for too long, or conversely, just with somebody who doesn't quite know what they're doing, a peel can cause full thickness burns. You know, you only need to go down into the reticular dermis, get to the hair follicle level, and you've got a real problem. And you know, I don't think it's acceptable really with any aesthetic procedure. It has inherent risks. It can cause things like that.
And I've seen a couple from, you know, very experienced plastic surgeons who've been, you know, doing great work for years. So it just goes to show how difficult a procedure it can be to get right.
And being completely genuine, how possible do you think it would be to recreate that sort of thing with the plasma machine?
As long as you followed the protocol and in fact make sure that you were going along in lines, not doubling back on yourself and not blasting over one area, and that you've had the proper training, which doesn't take long, virtually impossible.
It is. Yeah. And an interesting thing, a technical point that's been brought out by a few of the papers, it's missed in a lot of papers actually about the double pass.
Yeah.
Is that, and I don't want to drown people in science, but one of the things that's been shown is that at the edge, so we talked earlier about this zone of thermal modification, this zone of thermal damage. So at the zone of thermal damage, and for everyone to understand that just means the outer margin of the conductive thermal injury, where that occurs, you get what's called vacuolation. Now, in very simple terms, that just means that the cells are kind of being vaporized. Now, what's been shown is that actually creates a barrier between the first and the second pass. So even on a 3 or 4 joule pass, it shouldn't conduct any further.
Yeah.
Anyway, but that's a small point, small technical point. So continuing with this, the next bit of slides says non-ablative. Now, this actually is completely unique to the plasma machine. I think it's great. So it's basically saying the epidermis is left intact. Now, people shouldn't be confused, because if you do a high joule, and even on some of the low joules as we've seen, you will lose epidermis, but it takes about 3 to 4 days.
Yes.
And therefore, the advantage of that is,
well, it acts as a barrier, so they're not getting, you know, it acts as a protective, natural, biological barrier to reduce the risk of infection. And certainly, considering all the cases we've done, we've not had a single case of infection. And also, for the patient, actually, they're having this done in a hospital or in a clinic, you know, who wants to walk out the hospital or the clinic bleeding at the time, distressing their family, you know, although it must still make the point that if you're going at the very high treatment levels, like 3 and 4 joules, you know, you are going to get some sort of shedding at 4 or 5 days, which can be unsightly, but you're not going to have that same infection risk.
No, and that's one of the, and I would personally disagree. So a lot of the papers and a lot of the people who've looked at some of the older plasma, their protocols involve antibiotics afterwards. Yeah. And I personally think that's bad practice. I don't think there's any rule for doing that.
No,
I think,
not at all.
It's complicating what is a simple procedure, actually.
And we've treated quite a few diabetics and even a couple of insulin-dependent diabetics without any problems whatsoever.
I think later on as well, we'll talk about, again, our slight disagreement, and this means no disrespect to just our experience, where we think that the protocols for this actually in general are very simple, aren't they, in terms of pain relief. And this is essentially a very simple protocol treatment. Okay, so the next one, clinical improvements in skin tone, texture, and elasticity seen immediately. So a way that me and Mark often talk to patients, and we prefer to do, is to concentrate on them coming with a problem rather than it being nebulous.
Yeah.
So a lot of people will come on there and say, I'd like my eyelids improving, I've got a jowl, I've got it. So this is what that's referring to. And when it says it continues to improve, they've done histological studies where they've shown that the collagenesis that occurs with the plasma machine, and that only happens, by the way, if you've had a thermal injury. So it can only happen with CO2 laser or laser in general, and with plasma. It can't happen with skin peels. Continues to improve. So you can, with all confidence, say to a patient, you'll get good results at 3 months. And then what's your sort of standard line to a patient in terms of the improvements they'll see? I
say that they will see an improvement within 2 weeks, but actually the real big differences will kick in at around 3 months and probably then continue about another 6 to 9 months. But I think what's really nice is they see the improvement early on, because these treatments aren't cheap. And let's face it, we live in a society where we want things now, we want it immediately. We don't want to wait 3 months to see any changes at all, because I think there is always that risk. You've got patients back in your clinic within about a month demanding their money back.
One of the things that really interested me that Mark told me recently, so I'm giving away some of his secrets, is you were talking about looking at the terms that people search on the internet.
Yeah.
And I was shocked that you said that one of the most popular things that patients now are searching for, these lay people essentially, is collagen and collagenesis.
Yeah, really shocking, because some of the search numbers, if you look on the keyword terms and keyword tools to see how many searches there are a month, particularly for anti-aging and aesthetic treatments, they're very, very low. But collagen was getting over 1 million a month. But even sort of collagen treatments, collagen drinks, collagen skincare, collagen machines getting really big numbers, like over 10,000 searches in the UK per month, which is huge, considering particularly as well, the cost of the treatments on top of that. It's not like having a little bit of botulinum toxin in one area. Yeah. It's a lot more than that.
So the last two bits, and I think sometimes it's nice to debunk and explain complicated terms. So it says it creates a tremendous zone of regeneration filled with many times the normal amount of cells that create collagen and decreases of elastosis. So very simply, we talked about, so collagen, as everybody knows, is one of the building blocks of the dermis. And the key things about the plasma machine is that, well, in comparison to CO2 laser, which is the comparative gold standard, is that lasers, and you heard us say it before, but I think repetition is good, creates it in a planar direction. Now, the problem with that is that's not the natural direction that collagen grows in, it's vertical. And therefore, you don't have the same downtime, because all you're asking, all the plasma machine is asking the dermis to do is to modify and remodel, not to completely start again afresh at a different direction. The elastosis, that simply refers to sun damage that happens where you get elastin created again in an abnormal fashion. And the things that's shown with the plasma machine in simple terms is you get a decrease of elastosis, solar elastosis. Still at the year mark, decreased by about 10%, the studies have shown.
Okay, should we move on?
Yep, I think it's enough science.
Yes, okay. So talking about the full spectrum of treatments, and the nice thing is that it can be used for lots of different treatments. I mean, certainly it's not mentioned on there, but certainly for my patients who have perhaps had botulinum toxin or PDO threads or dermal fillers, a next treatment I can offer them is actually to improve the general appearance of the skin, the tone, the tension, and just to actually get rid of any little bits of pigment. But it's great for lines, particularly fine lines. I will sort of tell most patients that even at 1 joules of 3 treatments, it should get rid of fine lines. It will improve deep lines, but it's not going to get rid of deep lines at that level. I think if you're really looking at deep lines, you're looking at 3 to 4 joules with some sort of lifting procedure. Acne scarring, I will always tell patients you get something like a 30 to 40% improvement. Certainly, I don't know about you, Mark, but I feel the acne scarring treatments, it's not worth doing them at 1 joules. You really should be doing them at the 3 to 4. And although there is some downtime of 7 to 10 days compared with some lasers, which can be up to 3 weeks, it's still very minimal. Yep. And most of the patients I see or treat with acne scarring tend to be young women in their mid-20s, and they're so distressed by it that 7 to 10 days downtime they couldn't give a damn about.
Yeah.
Okay.
And also, and I think in terms of the downtime, so just to be clear, if you were to compare downtime between a CO2 laser and the plasma machine, you're basically halving it. So
of course you are.
If a CO2 laser is 2 weeks, plasma is 1. Conversely, if you're doing it on a high joule setting, your downtime is close to 2 weeks with the plasma machine.
Yeah.
Then that would be what it'd actually be more. It'd be 4 weeks plus actually with the CO2 laser, which I think is important because not many people have a month that they can take off.
No, or if they do, who wants to use their holiday, sat at home. Yeah. But the nice thing, which we will come on to some of our results with the 1 joule treatments, particularly 3 lots of them a minimum of 2 weeks apart, is we've been getting excellent results with them. And the downtime is just so minimal. I basically tell patients it will look like you've got a bit of sunburn. For some people, they literally have that for 1 day. For others, it's just 3 or 4 days. And you can wear makeup the next day so that they can literally go back to work the next day without any problems.
There's a lot of these bits actually that we can concentrate on now, but I think it'd be nice if we move on, look at the video,
sure,
and then we can kind of do it while we look at the photos. Maybe.
No problem.
Yeah. Right. So where is it we need to? Okay. All right. Again, sorry. Now, I know in a lot of these webinars that you can drown people with science. These two pictures are purely showing Fitzpatrick and Dr. Eric Bernstein. They've done a lot of work on the histological proof of the plasma machine. I think the important bit to realise here is just that if you're talking to patients or if you're a doctor yourself, you can be reassured that we're talking about quantitative data that has proven that the collagenesis and...
You have trouble saying that.
I know, I do. Apologies. Yeah, sorry. It's the northernness in me. Does occur because, but I think what's more important for the people on this is probably to see the photographs and see.
So that's my charming self just there, and that's Sam lying down. I'm wearing non-sterile gloves, and the handpiece does have a little firing button on it, but I prefer to use the foot pedal, which is a bit like the foot pedal of a diathermy machine.
Yep.
You can set the joules at any level you want. On this time it's 1. And you can also alter the frequency. Here I'm just putting some wet gauzes on, which have been put in some sterile saline, just to make sure that the skin has been properly hydrated. Now I'm actually using this at 2.5 hertz, the frequency, which basically just means you can move it over the skin almost continuously. And you will actually see there's a little piece of a plastic standing down, which is a 5mm spacer, which gives you your distance away from the skin.
And that's important because, as we know, the distance, so the conductive heat loss is factored by two things: the joule setting and the distance away. So you then get a sort of blast radius of 6mm, and in terms of the speed, the frequency at which it goes along, what do you prefer setting it at? I
prefer it to. I started off with 1 when I first was using it, just particularly because particularly when the face is rounded, obviously, and you're going over various areas, and I just felt more comfortable. Now, after a while, you just get so slick that at 2.5, I think 1, the treatment is done quicker, but more importantly, I think you get better coverage and you get less gaps, and so you get better results.
And returning to, because what I like with the way you've done it, Mark, is you've created really simple protocols.
Yes.
So you've gone through the literature, you've looked at what people have done, you've thought, okay, something that's overly complicated. So you talked to so we can see the wet gauze there. So why was it you chose wet gauze as your method for hydrating the skin, and why is it important to hydrate the skin?
I think you get better results because you're actually cooling the skin and you've got more water there, so that the heat is going through the epidermis to leave that epidermis intact and actually then just go through to the dermis, which is where he wanted to take his action. Okay, so that's the video. If you could pop the slides back to us, Tyrone, that would be much appreciated. Sorry, you're going to make a point.
No, not at all. Yeah, I think it's just important that I think sometimes people get overly concerned by something being a kind of a complicated technical exercise, as opposed to understanding what they're attempting to do, keeping it as simple as possible and executing it well.
Yeah.
And in a lot of the papers and a lot of the descriptions of this, people are doing all sorts of kind of, for me, overly complicated methods for both hydrating, and I don't think many of them think about cooling at all.
No.
And I think the wet gauze is perfect because, like you said, it creates 2 or 3 different things. I think it's a nice distraction for the patient.
Yeah.
It cools, as you said, it hydrates. Now, it's just so for people to understand what are the other methods that you can use to hydrate the skin. And I'm not sure if you answered about the importance of hydration.
Well, there are a few people using various masks, commercial masks that you can use, but I would be careful with those just to make sure that they don't contain any alcohol, because you don't want to be causing any burns. But I think
and a lot of the cleaning products that people use contain alcohol as well.
Exactly.
Don't they?
So you have to be very careful. So let's move on to the results. I think we've had enough of the science for the moment. We'll move on to some of the results. Then we'll talk about the actual commercial aspects and what sort of results we've been getting in our clinics, and then we'll go through some protocols before we launch into the Q&A. Is that okay?
Of course, yeah.
Okay. So do you want to start with the first one?
Yeah. So I think one of the most difficult areas to treat in terms of non-invasive work is the eyelids. And this photograph, the circles are showing where before, in the pre-treatment, she's got some lines at the upper eyelid and the medial area. This is often called the A-frame area in aesthetic work. And the post one at 3 months shows a clear lift. You've actually lost those creases, and you've got a lift of, it's not measured there, but of a couple of millimeters. And this was done on a doesn't actually show the JOULES there. Can you remember the JOULE setting for this one?
That one is done on a high setting, was my understanding. Right. Okay. So if we click through.
So this is one of your patients?
Yeah, this is one of the patients. So one of the nice things we can see is that she's got much improved skin tone, loss of pigmentation, and I think we can also see that there's a nice little lift there. The only thing I regret is I didn't put a picture in from the front, because this lady has got, when I say like Paul Newman eyes, those piercingly blue eyes, and everyone since the treatment has been going up to her and going, oh my, I never ever realized how blue your eyes were, because they've opened up her eyes.
So this is, so just pausing on this one for a second, I think this is a really good case. So what, prior to having the plasma, what would be your option is to create this in terms of the pigmentation, a slight tightness, etc.?
So I would have used previously either something like a peel, okay, or I would have used a skincare range like the Abaji Nude.
And so if we're using this at the low single pass, how long does the Abaji, well, I know, but I'm asking the question, how long does the Abaji take in terms of patient use to achieve that?
Well, a minimum of one course, which would be 6 weeks, but often in my experience, it can be two to three lots. And also,
it isn't completely reliable either.
It is, and I've taken it myself. It's quite distressing. The redness, the pains, the peeling. This young lady basically had a bit of redness for a couple of days on a number of occasions, and she's over the moon with the results.
I postulate that the dryness and problems you get with the Abaji, the toleration, are pretty equal to this, but this is for 1 week, and that's for 6 weeks. That's my kind of feeling. Anyway,
she's particularly pleased because she's getting married as well in a couple of months' time.
Not because of this treatment.
No, of course.
So this one again, I think this just shows classically how good it is at treating more than one problem at a time. So again, this is on a low energy treatment, so downtime minimal. You usually, how many times do you usually repeat these? Because this is same post third treatment.
I usually do 3 treatments, a minimum of 2 weeks apart, but I don't like to go any further than 6 weeks. And I'm 50 years old, and luckily my lines aren't as bad as in the pre-treatment one. But you'd be over the moon with that, wouldn't you? You really would. You'd love that. It was a non-surgical result. And this is another eye lift one with significant lift up.
No. The one thing I'd highlight about this, and I thought it was interesting looking through a lot of other people's work, and I think this is just a personal point about aesthetic work. I think it lifts the eyes beautifully, but one of the things that people get wrong is if you do a classic surgical blepharoplasty, you differentially excise more laterally as you go out. I think one of the important things with this is that it can look. This is a great lift, but I think part of the reason why this doesn't look as good as the degree to which it's lifted is they've lifted too much medially.
Yeah.
And I think if you look at a lot of other similar techniques, you should concentrate on the lateral aspect of this.
I couldn't agree more. But that may be just the way they've got the results. But certainly from a business point of view, it offers you the opportunity
to do it.
To offer in the lateral third something like a PDO thread lift or a dermal filler lift as a combination treatment to go with that. Okay, moving on. This one's pretty good to see. Again, from a non-surgical point of view, the lower eye bag, one of the most difficult areas to treat, and I think that's a significant improvement. I would be pleased with that. But also look at the general quality of the skin. And the other nice thing which brings up on this slide, which I've noticed on a lot of our patients as well, it's great for improving large pores, which is a big concern for many women. Any other comments about that one, or should we move on?
No, I think it's just self-evident, isn't it?
Yeah.
Really?
Okay.
So this is coming to the studies. So there's been loads of studies done. There were lots done in the kind of late 2000s, 2007, 2008 when plasma first came on the scene. This was one of the studies that I think was done by Fitzpatrick, and essentially it's just showing the degree of self-patient audited improvement that the clinicians showed, and so if you do and the best way of comparing this is it's very similar to CO2 laser, but without the downtime. I think we've established that now. But the next step up would be if you were doing blepharoplasties, this is what this is talking about, by the way, would be skin excision. Now, the satisfaction that people get with skin excision has been shown to be about between 90 and 95%.
Yeah.
The difference is it's triple the cost. The people who come to you simply don't want surgery.
No.
And the improvements here are anywhere between 40 to 70. And I think that's pretty acceptable, given that you're not usually just treating that. You're also treating pigmentation, the rest of the face, tightening, etc., etc.
Yeah.
And really, that's the take-home message. It's cheaper, easier, and the results are comparably good.
Yes. Yeah. Anything else to add from that slide?
No, no, nothing.
Just an aside to that, we have just carried out sort of a study on the low settings of 3 treatments on over 30 patients, and we will be releasing the results to NeoGen with the before and after pictures, so that for people who go on to purchase the NeoGen Evo machine, we are happy for people to use these in their clinical practice. And we are also just about to start some research on cosmetic scars and surgical scars, particularly on the face and the breast and the tummy. And likewise, as soon as those results come through, you'll have access to those pictures, so that if we can actually prove that we get a good result, and likewise with stretch marks, it'll be something you'll be able to also offer with your machine. I guess
the one thing to say, but I'm choosing not to say it now because I think it's when we've gone through a few more slides.
Yeah.
And the question and answer is patient selection. So, this gives great results for somebody who's got a moderate degree of ptosis or droop, who's got a certain skin type. Yeah, and so you need to know who it's going to treat and where you're going to get good results in terms of expectations.
And I think that's the same for any aesthetic or surgical treatment, is it? Yeah. It's not perfect for everybody, Right, so let's move on. Self-explanatory. If you want to talk about this one.
Yeah. I think the thing that I found, I think similar to you, is that if you've got dynamic RHYTIDES, i.e. dynamic deep lines, you can you're not, and Botox of course is the other modality, but and you're treating them purely with plasma, then I don't think you're going to get great results on the low energy settings.
No.
But I think you can get pretty good results, surprisingly good results on the high energy settings. And there are some people who just don't want Botox. They're not interested. They want a more natural look.
Yeah.
And again, other than CO2 lasers, which we talked about its downtime and the risks, I don't think there's much else in the arsenal, really.
I've got some good results with this with dermal fillers, but you end up using an awful lot of it, and it starts getting expensive.
It does,
because you're using 2 or 3, mils of good quality dermal filler.
And I think the same people who would avoid Botox would sometimes want to avoid fillers as well, wouldn't they?
Exactly. And an interesting point on that, I think, isn't it interesting? Some people are petrified of botulinum toxin but love fillers, and vice versa. Yeah. But almost everybody loves a machine because it's exciting science fiction technology, isn't it? It's almost like, ooh, what does that do?
Yeah, no, I agree.
So I think that is important. It's not mentioned on this slide, but that is after one treatment. And again, it's something else which you can add to the value ethically of your patient, but it's another treatment that you can have from a business point of view.
And in terms of sort of post-operative management, because it's a bit easier on the face, people recommend going down to a kind of 2 joule on the chest, don't they, for the same reason?
That's a 1 joule.
So, is it? I didn't know that. That is actually
shocked me, that one. Yes, it shocked me, that one. So particularly, on the arms.
So it's good that I've read up enough, isn't it, on this? Now I know our slides.
Yes, but but on the chest, where clothes are going to be, I would always use the 1 joule.
So it's the 1 joule. Right? I just presumed it was higher because it's completely white the pigment.
And I think it's the way things have changed. A couple of years ago, everybody was using these on 3 or 4 joules, and we knew you could get great results. But there were so many people we saw in clinic who were just walking away because, when you start talking about a week's downtime, there's something, well, I can't take a week off work.
And so technically, I think it's important for people to understand that, pigment lies above the dermal epidermal junction, doesn't it?
Right.
So therefore, the high joule setting goes down to the papillary, but I guess why would you need to go deeper?
No. Acne scarring. I've been getting some very good results with acne scarring. The only issue I've been having is that you get planned for the treatment, you space it out. Somebody takes time off work, and then they arrive on the day with active acne. So I always sort of pre-treat with cyclin for 4 weeks beforehand. Still doesn't guarantee it, but it just reduces that risks. And I think sort of the literature is saying, anything from like 30 to 40% improvement. And like all these modalities, I always try and undersell it and have them come back thrilled rather than promising the earth and then coming back disappointed.
Completely. I think the simple thing with plasma is that on a high joule setting, you're gonna kind of get through about 0.5 millimeter of whatever scar tissue you have.
Yeah.
And therefore, CO2 lasers, to be fair, it's one of the places where they do take over if it's really thick scarring. But again, for most of those patients, you know, they're not the average person who comes to the aesthetic clinic. You know, so for this, and this scarring that we see here is certainly not that.
No.
So a plasma machine should treat that if you presented that pretty successfully.
Yes. A quick note on that while it's there. So you've got one pass at 3.5. Now that's warm, you know, regardless of the anesthetic you use. And then a second pass at 4 over the top of it. I've had quite a bit of success, as I was telling you the other day, actually using diazepam 10 milligrams orally an hour before the treatment, obviously making sure that somebody is driving them so they're not driving them afterwards. And actually they've tolerated the treatment remarkably easy. So that's certainly a tip worth trying.
And what do you think about the role of sort of facial blocks, regional blocks?
Personally, I don't do them.
Yeah.
I don't think it's appropriate for my aesthetic clinic. And at the moment, I've never been in a situation where I've actually had to resort to that.
I think it's analogous to lip filler.
Yeah.
Where a lot of people start doing it.
Yeah, I was the same. I started with them. You know.
I think you realise that if you leave it on for long enough,
Yeah.
thick enough, and sometimes even reapply the topical.
Yeah.
I think the only little caveat I was going to mention it earlier is you mentioned the 20%. I think it's the tetracaine and I forget the mix.
23% lidocaine with 7% tetracaine.
So I think the key thing with that is one of the most painful areas around the eyes. It's tempting to use it there, but if you get it on the eyes, it's, you know, you'll get a kind of scleral injury. So
and for those of you clinicians in the UK, certainly Health Exchange have just started stocking it because I've been bugging them about it for quite a while.
it's expensive though.
It is. This is another one of our patients, again, showing great improvement in pigmentation, losing the age spots, and it's the uniformity of the skin tone. I mean, I've taken these pictures myself. I'm not a very good photographer, so I can tell you I've not added any effects to them because, you know, the first time I saw the before and after side by side, you think, my God, did I photo effect that second one or something?
Yeah,
you know, and she was absolutely thrilled. And also the smoothness and texture of her skin was dramatically improved. And this was another one of our patients. She's actually works in housekeeping at the McKindo, has never been able to have treatments like this before, so was absolutely thrilled. And I think you can see the loose skin here and the way it's actually pulled back, almost like she's had a thread lift or something.
Exactly. Yeah.
And I can assure you she hasn't. But again, the thing you can actually feel when you touch the skin, which is difficult to come across on a camera, is that actually her skin felt thicker than it did before. On the note of that, of the pictures and me not being a good photographer, we are going to ensure that all our future studies are done with a 3D vector camera, so we have much better before and afters for you. Okay, moving on. And this was another one from our study, and you can, everyone's been telling her how much tighter that area is, and she was absolutely over the moon. And again, I just stress, that's 3 treatments on one joule, you know. Okay, moving on. So the commercial potential, just to give you an idea, so primarily we've been using this in a study until we actually started now using it privately. And so these are the sort of prices that we have been offering and have had no problems with patients taking us up on those. Now, I obviously can't comment on your individual practice because I don't know where it is and what the sort of local population would support pricing wise. But certainly, you know, if you look, even taking the lower figure of 1,500, you only have to be doing one of those a week. And so, let's say you were very generous to yourself and only work 40 weeks a year, you're making significant money just on that. And often I use these in, you know, combination treatments. So I do a lot of PDO threading. So this is proving a very popular, you know, because, and I'm being sort of, you know, declaring quite openly here, normally for sort of cheeks and jawline, I would charge 1,400 through the PDO threads. And I would normally charge, you know, 1,500 to 1,750 for the face. So actually using it as a combination treatment, people love that idea.
And you're also kind of in the midst of creating the classical model with your wife, aren't you, so that she can do the lower set of treatments, sort of 1.5 joules.
Yeah.
And just people out there who might not know, kind of what are energists currently, what is their current advice on who can do higher joule settings and who can do lower joule settings.
And obviously this is important for your clinic. So, you know, if you are the doctor, you would be able to do them up to 3 to 4 joules. If you're an aesthetic nurse or you have an aesthetic nurse, you can go up to 1.5 joules. And a beautician up to 0.8 joules. So you can be doing other treatments, or other treatments can be going on while someone is using the machine to get the full value out of it all the time. Energists have asked me not to comment on the costs of machines or disposables, but certainly let me say that the disposable cost on something like that is absolute peanuts to make it almost negligible.
Yeah.
Okay. So if we want to move on, so we've been trying different things, and I'm going to quickly come to this because people have been, you know, and we've seen different papers of people talking at 1 joules, 2 joules, 3 joules, 4 joules, and different settings for different areas. I've certainly rapidly come to the conclusion of, because of the downtime and because of the results we've been getting on the low settings, I think you can offer both. So I will say to people, for instance, the price is $17.50 for the full face. You can either have 3 treatments on the lower setting of 1 joule with the less downtime, or if you would rather just have the one bigger setting, then you could do that. The only exception being I would go for the higher treatments on people who want significant improvement on really deep wrinkles or acne scarring, because I would make the point that once you go past 2 joules, the downtime is nudging towards the 3 to 4 joules. So why bother? Why make it complicated? Keep it easy. You know?
And I mean, and a lot of people's previous papers have documented doing one pass on 3.5 and then a second on a 4. And again, I think just keep it simple. You know, if you kind of conceptually think of the low passes around 1.5,
yeah,
the high one is around 3.5. If you want to vary that slightly, I think it makes very little difference.
Yeah.
Secondly, as you said, as soon as you've gone above 2, then you're gonna be shedding pretty significantly, aren't you?
Yes,
so
you're going to the week's downtime anyway. You might as well do the higher setting. I would add that, like anything else, this is easy to use, and somebody, you know, could train you up within a couple of hours or a morning, so you could literally be using this by the afternoon, and that's certainly how I did it. But I would recommend is that I think what takes time is, one, to get quicker. You know, you start off to doing a whole face in half an hour. I'm down to sort of 10-15 minutes now. But what is worth doing is, I think, on the lower setting, do 2 passes, you know, one sort of vertical, one horizontal, because you will end up with less gaps between the dispersion zones, and hence you will treat the whole skin better, it will heal quicker, and you'll get better results.
Completely, and it's to remember that the blast area is on a kind of normal distribution. So where you see a small area of erythema, the edge of that will not have given the same thermal conductive injury, and it's all based upon that. So you kind of want to aim for a very slight overlap, don't you?
Oh, definitely. Along-wise and side by side, of course. I've took no pre-treatment and pre-treatment, and this is really for the different Fitzpatricks, and you know, Fitzpatrick sort of classifications. I've had no problems on 1, 2, and 3 with no pre-treatments. And we were talking about this the other day, because you asked me sort of, would you treat somebody with Asian or Indian skin, so who are nudging a Fitzpatrick
without a Bajie?
Yes.
And it's worth, I think, explaining that. So we're basically talking about hydroquinones, aren't we?
And tretinoin, to pre-treat the skin. And sort of my thought is, I wouldn't take the risk, because I just think the potential downfalls are too distressing. My understanding is on the lower setting of 1 joules. Certainly, I know lots of people are using it in Southeast Asia without any problem. But I was thinking more of the sort of Indian subcontinent with a sort of 3 to 4 type skin. You know, I really would be quite distressing to, you know, create sort of a load of hyperpigmentation.
Yeah, I mean, I agree, and I think it's sensible to be safe. The papers that have been done have shown that they haven't had major problems.
No.
And so it depends what your patient population is, doesn't it?
Yes. Yeah. What are your thoughts, Mark, on sort of the use of various drugs topically after the treatments?
Again, I mean, it's as per any treatment, isn't it? I think they're useful.
Yeah.
I think, are they needed? I don't think they're required. Okay. I think the post-treatment stuff is more about day 4 onwards. You're going to get reepithelialization. you're not going to have the biological barrier you had. So I think it's about having barrier creams. I think in terms of pain, after the 3 joule plus settings, I think after 1 joule it's almost negligible. You know, I don't think it's a factor. I think after a 3 joule setting, that's a pretty serious issue. A lot of people will give people fairly strong painkillers to take. In terms of the Abargy Nuderm, again, I think that's more to do really with their Fitzpatrick skin type, really.
Okay. You wouldn't consider it for maintenance and
but that would, as a separate issue, of course, for everybody.
Okay.
Yeah.
Okay. Anything else do you want to add on here, or we covered?
No, I mean, I think the take-home message is you keep it simple, and you're not really benefiting the patients, you know, by doing anything else.
I agree. So, to the summary. Do you want to go through the summary?
Yes, because I know this summary page well. So I want to avoid just reading off the slides. So right, so we've talked. What we're going to do. This slide is basically repeating what we've talked about before. So here it's saying office versatility. All that's saying is that because the joule can be easily changed, that's the degree of conductive injury that you cause from 1 joule to 4. We've spoken about that's its versatility. So it can be used by nurses. Mark said before about beauticians. That, by the way, requires a different head, so you go on the 1 joule setting, and the head means that it's about 15 millimeters away from the target rather than sort of 5 millimeters, and therefore they get a smaller conductive heat conduction going through, right through to doctors being able to do it from the 3 joule onwards. In terms of the results, so we've talked about this kind of buzzword that's come through media more recently of neocollagenesis, which
wow, got it right.
On the slide it says it's not planar. That's, as I mentioned earlier, I think the reason they've said that is that the nearest gold standards that we've repeated many times is laser, and laser is planar, which is at a perpendicular axis of collagen regeneration to that of the natural, which is vertically. That histology has shown that it continues at a year. Patient results show that anyway, but it's nice just to have that quantitatively kind of backed up. Elastosis, I mentioned earlier, is abnormal solar elastosis of elastin. That decreases at 1 year. They've shown a decrease of around 10%. It was precisely 7% in the studies that were done, but around 10%. Most of the treatments offer specific but limited results. So they could, for example, if you were using a peel, they would improve wrinkles to an extent, may improve pigment, but deep peels won't have any degree of collagenesis because there's no true heat conduction occurring. It's chemical. With lasers, you can get, depending on, so lasers, we've not really mentioned this, are chromophore dependent. That's to say that the molecules that take up light, and therefore they have different frequencies. Depending on which laser you use, you may be able to treat wrinkles. Some may treat pigment. CO2 lasers can treat both ablatively, but it's such a downtime and painful procedure that you can't, as with this machine, flexibly just turn it down to 1 joule and still treat pigment.
Can I make a quick point, Mark? Because you mentioned lasers, and I'm actually looking at the picture of the 2 of us sitting in my room at the McKindo. I've just got a standard treatment room with a desk, a computer, yes, air conditioning, and a treatment couch. No, this isn't a laser room, although we've got a laser room. You don't need any laser room or any fittings and expensive fittings like that to get started.
Yeah.
Okay, I just thought I'd mention that.
Yeah, no, sorry, we've talked about it a lot, haven't we?
Yeah.
And what the last bit, so NeoGen treats multiple conditions simultaneously, so it's kind of repetition of the same. So you can treat pigment, tighten. The last bit removes precancerous skin lesions. So anybody out there, so I don't want people to suck eggs, but as you know, precancerous lesions are only in the epidermis. As soon as they go through that layer, they become cancerous. And on the low joule settings, similar to peels, so this isn't unique to plasma, but it's another nice thing to be able to do. You can treat all actinic damage and therefore prophylactically and preemptively treat skin cancer that may occur, which is, you know, for people who've spent a lot of time in the sun, which is good, because the only other things you can do are much more painful and aren't preemptive, are they?
No. Okay.